Welcome to the ocular and auditory chapter. First, let's talk about the anatomy of the eyeball. You have the sclera, which is the white part of the eye, the cornea, which is the transparent part of the eye, the pupil, which is an opening in the eye, your iris, which is the colored part of your eye, your choroid, which is the vascular layer of your eye, and your retina, which is the pigmented nerve. Your iris regulates light entering the eye. Your pupil adjusts according to the iris. Your vitreous humor fills posterior segment. Your ciliary body is suspensory ligaments of the lens. The lens changes shape, and you have an anterior chamber of your eye. The conjunctiva is a thin mucous membrane lining the inner surface of your eyelid. It folds back to cover a portion of the sclera and the anterior surface of the eyeball. The conjunctiva does not cover the cornea. It secretes substance moisturizing the eye. Bloodshot eyes and pink eye occur with dilation of the vessels in the conjunctiva. The conjunctiva does not go all the way around the eye. It folds, forming a cul-de-sac, and doubles back inside the eyes. When something gets in your eye, you lose contact. It cannot go back behind the eye or further. The furthest it can go is to the cul-de-sac. There are two groups of muscles associated with your eye, extrinsic and intrinsic. They work together and never one alone. Extrinsic eye muscles move your eyeball in its bony orbit. Intrinsic muscles move structures within the eyeball. The external muscles consist of three sets: two side muscles, two top, and a bottom muscle, an oblique muscle. We're going to look at a picture of this in a second. The lateral rectus muscle allows the eye to turn out and horizontally temporarily towards the temple, and the medial rectal muscle medially towards the bridge of the nose. If you turn your eye up and out, that is the superior rectus muscle. The inferior rectus muscle allows you to turn your eye down and out. The oblique muscle works a little differently, allowing the eye to turn up and in for the inferior, or down and in for the superior oblique muscles. These six muscles together coordinate eye movements. You have these in your handouts. I suggest that you go through and read these and make necessary notes on the pages of the codes. At the beginning of the section, I want you to write all of the terms for the eye. You have blephar for eyelid, so a blepharoplasty is a reconstruction of your eyelid. Cant means corner of eyelid. Cochlea means cochlear. Conjunctive means conjunctival. Dacry means pertaining to the tear duct. Goni means angle. Irid means iris. Carot means corneal. Phao means lens. Photo means light. Photosis means droop. Retino means retinal. Rhino means nose. Sclera means ocular sclera. Staped means stapes. Tarso means margin of eyelids. And opia means vision. Here's the handout you should have in your study files. Let's look at the muscles. Like I said, you have three sets of muscles. You have your top muscles, your side muscles, and your oblique muscles. The one thing you need to know about these muscles is there's such a thing as a horizontal and a vertical muscle. Turn to the eyeball codes in your CPT book. These codes are 65091 to 65290. Codes listed first include three ways to remove the eye. Malignancy is most often the reason for the dramatic surgery. Evisceration of ocular contents is coded with 65091 through 65093. And it is the removal of the contents of the eyeball, leaving the sclera, muscles, and sometimes the cornea in place. There are two codes. The second reports evisceration with placement of an implant. Prosthetic eyes are extremely lifelike. The only way you may be able to tell it's not real is failure of the pupil to change size. Evisceration is the least invasive of the procedures and is performed for less serious conditions. Inoculation of the eye without implant is next. These are codes 65101 through 65105. Inoculation is the removal of the entire eyeball without rupture. Conjunctiva may remain. I would write this definition in your book. Codes specify if an implant is placed and if muscles are attached. Implant codes are for permanent implant placement, not a temporary placement. Extenuation of orbit is coded with 65110 through 65114, and this is an invasive surgery. Extenuation describes removal of contents of a cavity. The underlying condition is more serious or invasive. In this case, muscles, fat, and even bone in 65112 are removed. Secondary implant procedures 65125 through 65175 list secondary procedures. In these situations, modification of an implant, secondary implant placement, reinsertion, or removal of an implant may be required. In the case of extenuation for more serious cancer, it may be best to allow healing of the area before placing an implant. Removal of foreign body is 65205 through 65265, and it begins with parenthetical instructions worth reviewing. Some of these codes specify magnetic or non-magnetic. This is important because metal objects frequently enter the eye via industrial accidents. They must be removed. Also, there are magnetic extraction methods. Repair of laceration 65270 through 65290 listings also begins with parenthetical instructions. A laceration is a torn or jagged wound caused by blunt trauma, and technically not a cut, but this term is frequently used to describe this. Select these codes based on the location of the laceration, conjunctiva, cornea, or sclera. Anterior segment codes are 65400 through 66999. The anterior segment begins with cornea, 65400 through 65782. The cornea is the outermost and transparent layer of the eye. Opaque, O-P-A-Q-U-E, means impervious to light. Opacity is lack of transparency. Both are problems if applied to eyes and vision. If the cornea is not clear, it may require removal. Excision codes 65400 through 65426 list a handful of codes and includes biopsy. Removal and destruction codes 65430 through 65600 can be scraping, cauterization with chemicals, or destruction by cryotherapy, photocoagulation, or thermocauterization. Finally, keratoplasty 65710 through 65757 comes next. Keratoplasty, kerato means cornea, is any surgical modification of the cornea and often includes insertion of a piece of the cornea for another location. There are instructions at the beginning of this section regarding reporting grafts and their preparation for corneal transplant. There is an add-on code 65757 for backbench preparation on the allograft, just like we've learned in other sections. Anterior chamber 65800 through 66030. Turn to that section now. The incision section of the anterior chamber starts with paracentesis. Paracentesis is the passage into the cavity of a hollow instrument to remove fluid, in this case, aqueous humor. Goniotomy 65820 is the surgical opening of the trabecular meshwork, usually in congenital glaucoma, meaning performed on infants and children. Included are parenthetical instructions regarding the use of 63 modifier and other instructions. Trabeculotomy ab externo 65850 involves cutting from outside of the eye inward to reach the Schlemmann's canal. The anterior sclera section 66130 through 66250 is divided into excision, aqueous shunt, and repair or revision. It begins with excision of lesion, sclera 66130, and most of the procedures aim at correcting pressure problems in the eye. Turn to the iris and ciliary body section 66500 through 66770. It is grouped by incision, excision, repair, and destruction. Ciliary bodies are important suspensory ligaments of the lens. As explained, the lens is soft and changes in tension of the ciliary bodies. Now turn to the iris ciliary body section 66500 through 66770. This is grouped by incision, excision, repair, and destruction. Recall from earlier, ciliary bodies are important suspensory ligaments of the lens. An iridotomy is a transverse division of some of the fibers of the iris. There are 2 codes listings for these procedures. Look at 66761 through 66770. Lens 66820 through 66940 is grouped by incision and removal. Cataract removal is the primary procedure in this category. There are instructions for review explaining the components of these procedures reported with the codes. Pars plana approach is an open procedure to get to the back of the retina or vitreous. Intraocular lens procedures 66982 through 66986 list 5 codes. These codes report procedures of the lens and its capsule. These are very common procedures that I'd like to review with you. Intraocular lens procedures are called cataract implants. Look at my page and notice how at the top I put the extracapsular extraction definition, which is the partial removal of a capsule, and the intracapsular is the removal of the lens and capsule of the lens. Let's look at these common procedures, which are the cataract implant codes. For cataract procedures, they are implanting intraocular lens. The most common codes are 66984 and 66982. The only difference is 66982 is a complex intraocular lens insertion, and 66984 is extracapsular cataract removal with insertion of intraocular lens. If they do 66984, but it is complex, requiring devices or techniques not generally used in routine cataract surgery, such as iris expansion device, suture support, or intraocular lens or primary posterior capsulorhexis, or performed on patients in the embryogenic developmental stage, then you would code 66982. While we're on this page, I want you to look at the lens section incision. 66821 is the dissection of secondary cataract by laser surgery YAG. On the next page are the parenthetical instructions for the cataract procedures that we discussed. The parenthetical notes state to code implant at time of concurrent cataract surgery, see 66982, 66983, and 66984. To report supply of intraocular lens prosthesis, use 99070. For ultrasonic determination of intraocular lens power, use 76519. For removal of implanted material from anterior segment, use 65920. For secondary fixation, separate procedure, use 66682. For use of ophthalmic endoscope, use 66985 with 66990. The use of an ophthalmic endoscope is an add-on code, 66990, and is listed on the next page. Now let's talk about the posterior segment. These are codes 67005 through 67299, and it begins with the vitreous, 67005 through 67043. These codes report removal or aspiration of vitreous, which is the liquid in the posterior segment of the eye. Implantation of intravitreal drug delivery system 67027 reports procedures for drug delivery devices. There's a good picture in the CPT book. The pars plana approach mentioned above is demonstrated. Retina and coronoid 67101 through 67229 is grouped by repair of retinal detachment, and prophylaxis. Release of encircling material 67115 reports removal of the band. The posterior sclera 67250 through 67255 contains 2 codes for repair. Ocular adnexa is 67311 through 67999 and deals mainly with extraocular muscle. A coordinated effort of all muscles is required to indicate eye movements, like of a batter attempting to hit a 90-mile-per-hour fastball. Strabismus is a lack of parallelism of the visual axis of the eyes. Strabismus surgery in this section is grouped into that performed for the horizontal 67311 through 67312 and the vertical 67314 through 67316 muscles. With the transposition procedure 67320, the superior rectus muscles, one of the extraocular muscles, is transposed or moved. Adjustable structures can be placed in strabismus surgery, 67335. This section of the CPT contains valuable pictures worth reviewing to make sense of these procedures. Let's look at those together. This is the strabismus surgery section of my book. You can't see it, but I did put a note at the top that says vertical muscles move the eye up and down. Horizontal muscles move the eye side to side. These codes are based on whether the muscle was vertical or horizontal. You have, as you can see from this picture, which ones are vertical and which ones are horizontal. The medial rectus muscle and lateral rectus muscle are horizontal muscles. The superior rectus muscle and the inferior rectus muscle are vertical muscles. So let's look at the codes. Strabismus surgery, resection or resection procedure, one horizontal muscle. And then indented underneath it, you have two horizontal muscles, one vertical muscle excluding the superior oblique, or two or more vertical muscles. So these are based on how many horizontal or vertical muscles the procedure was done on. You must look at the add-on codes too, and I put a note of that in this book. You have transposition procedure, any extraocular muscle, so that would be added in addition to the code above. You have strabismus surgery on patient with previous eye surgery or injury that did not involve an extraocular muscle, 67331. And you have strabismus surgery on a patient with scarring of extraocular muscles or restrictive myopathy, 67332. You also have the strabismus surgery, any procedure, superior oblique muscle. The superior oblique muscle would not be coded with the codes above here. Your other add-on codes are 67334, strabismus surgery by posterior fixation suture technique with or without muscle resection. And then 67335, placement of adjustable sutures during strabismus surgery, including post-operative adjustments of sutures. And then 67340, which is strabismus surgery involving exploration and or repair of detached extraocular muscles. The next section is the orbit, 67400 through 67599, and it lists exploration, excision, and decompression codes. There are several parenthetical instructions in this section that you should review. Now let's turn to the eyelid section. Eyelids 67700 through 67999 are grouped by incision, excision, destruction, tarsorrhaphy, repair, and reconstruction. Drainage of an abscess of the eyelid is 67700. A blepharotosis is skin hanging over the free border of the eyelid. Repair of this is 67901 through 67908. Conjunctiva is grouped by incision and drainage, excision and or destruction, injection, conjunctivoplasty, other procedures, and lacrimal system. Conjunctivoplasty often includes placement of a graft at the same time. Read these codes carefully for specific procedures. Lacrimal system 68400 through 68899 is grouped by incision, excision, repair, and other procedures. Lacrimal glands secrete lacrimal fluid, which serves to clean the eye and moisturize the cornea and conjunctiva. Blinking spreads the fluid, moisturizing these structures. Fluid is pushed towards the medial angle of the eye to accumulate in the lacrimal lake, from which it drains to the lacrimal sac and finally to the nasopharynx, and it is swallowed. Excision of lacrimal sac, dicryocystectomy 68520, can be required for infection or tumor. Turn to the medicine section now. Listed in the medicine section under ophthalmology, which is 92002 through 92499, are codes reporting services for general ophthalmology services, special ophthalmological services, contact lens services, and spectacle services, including prosthesis for aphakia. There are instructions at the beginning of the section defining the difference between intermediate and comprehensive services. There are also instructions regarding special services. The first codes listed here are based on new and established patient criteria and the level of service provided. They are evaluation and management codes. This can be confusing. At the beginning, the first codes listed are E&M codes, which General Ophthalmological Services 92002 through 92014 list 4 codes for new patient and established patient. Definitions for new and established patients are important. A new patient has not received services by the provider or someone in the same group within the past 3 years, and an established patient has. Special ophthalmological services are 92015 through 92145, and it goes beyond the services included under general services. These services are reported in addition to general ophthalmological services. With these services, a special evaluation of part of the visual system is made, which goes beyond services included in general ophthalmological services or in which special treatment is given. Determination of refractive state 92015 is an eye exam. If refractive lenses or glasses are required, it is included in this code. This includes all of the specifications of the lenses. Ophthalmoscopy 92225 through 92260 is the examination of the fundus or posterior portion of the anterior of the eye. It can be direct using an ophthalmoscope or indirect, where the doctor wears an indirect scope and holds the lens separately in the hand close to the patient's eye. There is a very helpful illustration of this in the CPT book. Finally, you have contact lens services 92310 through 92326, and this lists codes for fitting of contact lenses. Contact lens prescription and specification is not part of the general ophthalmological services. This service includes fitting, instruction, and training that may require revision and even refitting. There are instructions at the beginning of this section to review. Spectacle services, including prosthesis of aphakia, list fitting of spectacles. The medical definition of spectacles is lenses set in a frame that holds them in front of the eyes, used to correct errors of refraction or to protect the eyes. If that sounds like glasses, you are correct. Aphakia is absence of lens of the eye. A spectacle prosthesis may be inserted for aphakia. 92352, 92353, and 92358. Other codes in this section mention except for aphakia for lenses for glasses.